YouTube channel. Today we'll be talking about the concept of contagion, part 2, and we'll be going through some definitions associated with the concept of contagion. Then we'll go on to discuss the chain of infection. Alright, so let's start by talking about the classification of diseases. So we have acute diseases, we have chronic diseases, we have latent infections, we have localized infections, we have generalized infections, we have communicable diseases, then we have non-communicable diseases. Then we'll talk about the factors that influences communicability of a disease. Then we'll talk about the time course of communicable diseases. We'll discuss incubation period, prodromal period, the illness period, the convalescent period, and the period of communicability. Then we'll talk about the chain of infection. Alright. So when we say acute infection, an acute infection is an infection that arises quickly and progresses rapidly. It is characterized by onset and a short-term duration, by a rapid onset and a short-term duration. So most of the times, most of the diseases that we encounter is the acute disease. So we have examples. We have influenza. The influenza is a viral disease, is caused by the influenza virus. Then we have the common cold. Then we have the strep throat. We also have gastritis, enterogastritis or gastroenteritis. Then we have the urinary tract infections. So these infections are acute because they are characterized by rapid onset and then they have a short-term duration. So these diseases are all acute diseases. Then we talk about chronic infections. For the chronic infections, they last for a longer period of time. Which is approximately weeks or years, without any resolution. So example, we have the hepatitis B and C, they are all viral infection. Then we have the retroviral infections like HIV and AIDS. And we have tuberculosis. So these diseases are all chronic diseases. So there is no way you get a tuberculosis and expect it to go within days. Now, it takes a number of times. Without treatment, it can linger until death. Then we have the latent infections. So we talk about the latent infections. They are infections that are hidden or remain dormant. So for instance, most of the people who are latent infected people or latently infected do not show any sign of infection. They have no symptoms. They are asymptomatic, but they are capable of transmitting the disease from one person to the other. So for instance, when someone gets HIV/AIDS, there are certain period that the person might not show the signs of HIV. The HIV virus remains dormant in the person, but then the person is capable of transmitting the HIV virus from one person to another. Then we have localized infections. So localized infections are infections which are limited to a specific site of the body. Example, we have otitis media. So when we talk about otitis media or otitis externa, we are talking about the ear. So otitis media or otitis externa is a bacterial disease that often affects the ear. Then we talk about conjunctivitis. the red eyes, that one to affect the eyes. Then we have the tonsillitis. They are all bacterial infections. Tonsillitis affect the tonsils. Then we have the dental caries, or cavities. That one too, to affect the teeth. Then we have impetigo. Impetigo is more or less like a skin rash. Skin rash. It looks just like the chicken pox. But it's a bacterial infection. Alright. Then we talk about generalized infection. So generalized infection, they are also known as the systemic infection. And this happens when the disease spreads throughout the body, affecting multiple organs. So HIV and AIDS is also a generalized infection. Talk about malaria. So for the issue of malaria, malaria is a a parasitic disease or a parasitic infection, and it actually attacks the red blood cells. It eventually affects multiple organs like the spleen, the spleen, the liver, and sometimes in extreme cases, the central nervous system. That is one we have cerebral malaria. Then we talk about diseases like tuberculosis. Tuberculosis too. It affects both the lower and upper respiratory tract in extreme cases. Then we have systemic lupus erythematosus. Then we also have typhoid. So these are all generalized infection. They affect all parts of the body. They spread through all parts of the body. They affect all parts of the body, or multiple organs. Then we have communicable diseases. These are illnesses caused by microorganisms such as viruses, bacteria, fungi, and parasites, and can be transferred from one person to the other. So these communicable diseases, all communicable diseases are transmitted through the invasion of infectious agents. Or pathogens. Okay. Then we also have non-communicable diseases. For the non-communicable diseases, they are often diseases which affect us as a result of lifestyle. So lifestyle. So for instance, we can talk about hypertension. We can talk about stroke. We can talk about diabetes. That is the type 2 diabetes. Type 2 diabetes. Not the insulin type diabetes. Type 2 diabetes. So these are all diseases that are affected by lifestyle. So basically we have communicable diseases and non-communicable diseases. What we have to know about the communicable diseases is that they are caused by infectious agents, invasion of infectious agents. Okay. Now let's talk about communicability of a disease. Communicability of a disease is the ability of the disease to be transmitted directly or indirectly to a host. So for instance, if we have an infectious agent, the ability of the infectious agents to transmit from one person to the other or transmitted to a host is what we call the communicability of a disease. And factors that influence And factors that influences the communicability of the diseases includes the source. The source. Then we have the number of infectious agents. So here, if the number of infectious agents is significant, it can evade the immune system and cause a disease. It can evade the immune system and cause a disease. That's if the number of infectious agents is significant. Then we have the source through which the infectious agent is coming from. For instance, infectious agents that are transmitted sexually or sexually transmitted infectious agents are able to cause disease directly than that are transmitted, let's say, orafically or through contaminated water. That is why the source to also come into play. So blood contact is faster than, let's say, transmission through foodborne, or waterborne. Sexually transmitted too. Also enhance the effective transmission of diseases than the other sources. Then we have the capability of surviving. So the capability of there are certain viruses or infectious agents that are capable of surviving than the others. For instance, HIV viruses, they they attack the immune systems. They attack the immune system directly. Those that are responsible to fight our disease, they are those the HIV virus attack. So they have an effective way of evading the immune system and therefore can thrive or have a high communicability than the other viruses or infectious agents, like, let's say, um, plasmodium parasites. These parasites are often destroyed by the immune system. They get rid of these parasites more often than other viruses like the HIV virus and the hepatitis B virus, etc. Because these parasites do not attack the immune system, it actually attacks the red blood cells and the other immune components like the WBCs and then the macrophages, etc., can fight against the plasmodium parasites. But it's not so in HIV viruses. Then we have the percentage of host population that is susceptible to the infectious agent. Okay, so we have a number of people. We have a number of people. Let's say 5 of them. And out of the 5 of them, out of the 5 of them, 4 of them are not susceptible or are unlikely to contract the disease. So if this one person gets the disease, either this person recovers or dies. There is no transmission of the disease anymore. So this is also a factor that explains the communicability of diseases. So the more we have susceptible hosts, the more the disease spread. So out of 100, a population of 100 people, if about 98% of the people are susceptible to the disease, then the disease can thrive.